At KJc10YtI, we are committed to providing valuable solutions that improve patient experience, provider excellence, and efficient care. Focused on clinical and economic principles of consistency, choice, and comfort, we offer next-generation wound closure products for laceration and trauma repair. Our suite of unique products offers specific clinical advantages for both the user and the patient. Let's take a look at Novafil sutures. All wounds to the dermis experience considerable edema in the first 24 hours after skin surgery. However, current monofilament sutures are relatively inelastic and may negatively impact scar formation and cosmesis. Novafil suture is an elastic, synthetic, non-absorbable monofilament suture. It is made from polybutester and designed to replace nylon and polypropylene, better suited to handle edema and better suited for skin closure. Novafil suture has three major advantages over other non-absorbable monofilament sutures. 1. Elasticity. You can feel the stretchy texture of the Novafil suture. The unique elasticity of this suture makes it easier to handle and tie. For you, this means efficiency and tighter knots. For your patients, the suture stretches with edema and relaxes when the swelling subsides, without creep. That translates to better cosmesis. 2. Hydrophobic. Unlike nylon, Novafil sutures do not absorb water once inside the body. This means that the sutures are easier to remove, a key benefit for both you and your patient. 3. Blue color. The blue color is designed to provide greater visibility. This is particularly important when working on the scalp. Novafil sutures offer more advantages. By replacing nylon and polypropylene with the Novafil suture, you can reduce the number of permanent monofilament suture types by 50% and significantly reduce the number of product SKUs that you manage. This significantly reduces complexity and makes inventory management and ordering that much easier. Steps for use. 1. Each suture comes in a Tyvek pouch to ensure sterility. Peel open the Tyvek pouch to expose the suture packet. 2. Peel back the tab at the end of the suture packet to expose the suture needle. Let's review the anatomy of a suture needle. A needle has three parts. 1. The tip or point, which is the first point of entry when penetrating tissue. 2. The body, which determines the curvature of the needle. And 3. The swage, which is where the suture is connected to the needle. Removing a suture from the packaging. 1. Grasp the needle firmly at 1/3 the distance from the swage. This is for optimal needle performance and your safety. We have designed our packaging to make it as easy as possible to grab the needle in the right location. 2. Remove the needle from the foam. 3. Pull the package away from the needle. This is the safest way to remove the suture from the package. To remove the memory in the suture, simply grab the suture at each end, taking care not to grab the needle, and gently pull a few times. This will relax the memory and straighten out the suture. Suture as you normally would. Note that with Novafil sutures, it is easier to tie tight, secure knots. In order to optimize needle performance, remember to avoid grasping the tip of the needle when suturing.